I am here with multiple hats. I'm the Wisconsin Section Vice Chair of the American Congress of Obstetricians and Gynecologists. I am also the President-elect of the Milwaukee Gynecological Society, and I'm a clinical professor for the Medical College of Wisconsin and have been for 24 years assistant clinical professor, at the University of Wisconsin-Madison. I'm also the mother of 7 children, 4 of my own and 3 stepchildren, and I belong to Community United Methodist Church in Elm Grove. You're receiving now the Wisconsin Section position statement on this bill, which we oppose. And I'm a novice at this, so I'm sorry that I'm not as eloquent as the medical student and the pediatrician who spoke earlier, and I do echo all of the things that they said for many, many reasons. I think that their information was accurate and medically accurate and scientifically based, and I think that's an important part of what needs to remain in the bill. And Wisconsin OBGYNs support age-appropriate, science-based, medically accurate sexuality education beginning in kindergarten through the 12th grade. Sexuality education should be an integral part of comprehensive health education in Wisconsin schools and communities. Sexuality education should encourage young people to delay becoming sexually active. And for young people who are already sexually active, it should encourage use of contraception and barrier methods to prevent both unintended pregnancies and sexually transmitted infections. We oppose Senate Bill 237 and AB 337. This legislation would take Wisconsin backwards. It would deny Wisconsin teens the tools they need to make safe and healthy decisions on sex and sexuality. Effective sexuality education programs encourage young people to delay becoming sexually active, and if sexually active, to use contraception and barrier protection to prevent unintended pregnancy and sexually transmitted infections. This legislation would stifle critical, proven prevention efforts for our Wisconsin youth. Best practices and research-based evidence shows that sex education programs, including an abstinence message coupled with fact-based information about contraceptives and condoms, are the most effective. All obstetrician gynecologists are encouraged to advocate and participate in sexuality education programs. As far as I did read the entire bill, and I did look at the financial report, and I did look at the amendments, but it was not clear to me, because I think the original bill said that this legislation would ban doctors and nurses from classrooms across our state where human growth and development are taught. Apparently there was an amendment to that. Wisconsin OBGYNs support medically and scientifically accurate sexuality education that is verified or supported by research in compliance with scientific methods, published in peer-reviewed journals where appropriate, and recognized as accurate and objective by professional organizations and agencies with expertise in the field of sexual health, including but not limited to the American College of Obstetricians and Gynecologists and the Federal Centers for Disease Control and Prevention. This legislation substitutes a problematic definition of medically and scientifically accurate sex education. This definition is not in the best interests of our youth or our communities. Wisconsin OBGYNs encourage parents to be involved in their children's sexuality education. This legislation eliminates an important practice currently in place today in our state, which ensures that parents are notified when sexuality education is not being taught in their child's class. Wisconsin OBGYNs also oppose Senate Bill 237 because of its short-sightedness in rejecting the broadest possible federal funding assistance in these difficult economic times, funding for proven sexuality education programs. And the supporting documents are from the Guidelines of Adolescent Health Care. 2 years ago when the Healthy Youth Act was being discussed, I submitted testimony at that time via email because I was at a conference for our specialty group. It is imperative that for the health of our teens and families and the financial burden to our state, that you support the Healthy Youth Act and oppose this new bill. I was invited to speak to mothers of middle school youths at a largest church in the Waukesha County a few years ago on adolescent sexuality. In preparation, I did review the most current statistics and recommendations for educating teens and their parents. I would also like you to know that the CDC released just a month ago a new report on some of these statistics, and it is available on the CDC website. 25% of high school teens have sexually transmitted infections. In African American teens, 50% have an STI. The number of teen pregnancies in Wisconsin had increased over the past 2 years at that time, despite years of decline. Thank you. As someone has already mentioned, babies are twice as likely to have a low birth weight and higher incidence of prematurity, costing the state huge amounts of health care dollars if they're born to teens. When teens get pregnant, 90% are covered by Medicare. We are seeing tremendous increases in our office. There are so many young women who are on Medicaid right now, and our state can't support that anymore. They typically don't finish high school, they continue to live in poverty, and their children have many more health problems and less chance of success in education. When I was a resident in obstetrics and gynecology at Mount Sinai Medical Center in Milwaukee, I saw a 14-year-old who had twins and who had already delivered a baby at 12. The youngest girl that that was pregnant in our clinic was 10 years old. I had one woman at 21 who had 7 children, and because of the state laws, we couldn't do a tubal ligation, although she desired it, because she wasn't 21 until that point where she had 7 children. I would lay awake trying to figure out how we can stop that cycle. And we have to educate these teens, and we know that that's the best way to at least have some impact. It's not the total answer. We're always going to have this kind of problem, but at least we can continue to try and make headway. I know this bill does not say that abstinence only is required, but it does remove teaching, the requirement for teaching about contraception. When we have abstinence-only education or don't talk about contraception, we're not getting the complete message to these kids. And 50% are going to be sexually active. No matter how hard we try, no matter what we tell them, they're not going to listen to us. This is a subdivision mailer that I just got. This is my neighbor, and the son is the same age as my 20-year-old son. My kids are 20 to 32, and this is reported to be a subdivision magazine. However, when my medical office wanted to have an article in there, which they're promoting professions and neighbors to put articles in there, I was told that we couldn't be featured in this magazine because my office, as an OBGYN office, prescribes birth control. Unfortunately, this young man at age 16 fathered a child, and it talks about the fact that this 4-year-old is now attending university school in the suburb of Milwaukee, which is wonderful, but that is not what happens to almost all of these teens who have babies. They often... I'm sorry. Thank you.
Representative Thiesman.
I'm just going to ask you to repeat something because I didn't quite hear it. You mentioned there was an amendment on something earlier.
Yes. In the original bill, it stated that healthcare professionals were banned from volunteering to teach sex education in the schools, as far as I could read it.
Okay, yeah, that was addressed earlier in the testimony. They are not banned. What it does is it removes the immunity that they have under the current law. Because under current law, after they fill out the forms, they are allowed to come in and give instruction to the students, and that instruction has immunity from any kind of prosecution, and that is what's being removed. They still can come in and teach the courses if the school district wants them to do that. So I just wanted to make sure I heard that correctly.
And we can. I think this is an important topic for you and the folks you represent. So we can ask Legislative Counsel to clarify this. But I think there's not been an amendment on that part of the bill, but I think there's been a misinterpretation by some folks, like I've been finding with all different parts of this bill. And I think I'll just let Legislative Counsel explain it.
What the bill is doing is saying that under that specific program, healthcare provider would not be able to come into a school and provide instruction in home human growth and development. So it's essentially, they're not prohibited from coming in, the way I read it, but they don't come in under the auspices of applying through DOA and being granted the immunity among other things.
Immunity, I'm not clear, because I have a lot of colleagues, and I have given many programs at our schools, and part of our college encourages that to do so. So I don't understand what the immunity is. I know that in Juneau County in 2010, the DA was trying to arrest teachers if they taught how to use a condom. So I'm not sure what this immunity...
It's a very specific state-sponsored program.
Would it be true that statute that would normally apply to a very different kind of application than how it was used in this new law? I mean, are we talking about an old part of the state statutes, the immunity portion?
Well,
Was that created brand new when the last law was passed?
That I don't know.
Okay. I think
But I
know
can
the
check
answer to
in.
that.
Okay.
I won't say for sure.
But I can check.
The other thing I just want to point out is that, we can guilt our children into doing things, but at some point it's going to have its ramifications. And I know there was a young woman who committed suicide last year in our community, and part of that was based on her, as far as I understand, and this is not factual because I didn't speak to her or her parents, but the mothers that I communicate with in my office seem to think that this was related to the fact that she had a sexual encounter, was so ashamed and so guilt-ridden that she couldn't talk to her family about it, and instead killed herself. And I see women in my practice who, when they do get married, can't have consummation of their marriage because they are so affected by the guilt that has been promoted for such a long time to them. And this is a very real issue on a day-to-day basis with patients that we're trying to give accurate information and have them have healthy relationships as they become adults.
Representative.
Thank you, and thank you for waiting and testifying. I guess we're all legislators. I'm not a doctor, but we do rely on a lot of the medical information that we get from people, and hearing from you and your group means a lot, given your direct role and career as an OBGYN and in this group. And I guess we all say we sort of agree on outcomes, but if you were to say, from your experience as an expert, if our goal is to promote healthy lifestyles, reduce teen pregnancy, and reduce sexually transmitted diseases, and I think that's a pretty good outcome, is this bill heading in the right direction?
My concern is that it doesn't address contraception at all. And kids need to hear that, because as much as my kids went to church every Sunday, they went to youth group, I chaperoned mission trips and the Milwaukee Youth Symphony to China, kids are going to try and have sex, and they'll figure out any which way they can. And so if we don't talk about contraception, we're missing a big part. And in this bill, a community can opt out of that. And the kids in New Berlin have sex.
I don't know about that.
When Senator Lasich was interviewed on the TV on November 2nd, and she said that parents and churches should be able to make these decisions about what their school district offers, I guess maybe I don't understand. This is a public school program, and this is the state that is making this decision. And so, to me, how can she say that the churches should be able to determine what is taught in that community? My patients come from New Berlin. I'm at the corner at Gerke's Corners. I'm right where Waukesha, Brookfield, New Berlin, that whole area comes together. And I can tell you that kids are having sex. They want to know about contraception. And my church teaches it. I taught some of the sexuality programs for probably 15 years at our church. It's not all churches, are saying you can't talk about contraception.
Thank you. Anybody else?